Hi everyone, I am Srimay from MediVaah and I am here to discuss different procedures with you as we go in our further journey. Today I would be discussing something very interesting and a simple procedure that you would have learned or you would have seen during first year. Let me take you back to the time when you were in first year. You would have gone first time to the hospital. In your exposure to emergency, you would have seen the hospital doctors and nurses, they are quickly donning the gloves and they are running for the procedure. Whereas when I think about myself back that time, I was struggling to put my hand inside the glove and I have torn almost 2-3 gloves to do that. So, to make it more easier and simpler for you, I am going to discuss that. What is gloving? Gloving is a procedure when we are going to put on the gloves in our hand in order to maintain hygiene and to protect ourselves from getting any infection or giving infection to the patient. Let us focus on medical gloves. When are we putting medical gloves? It is basically used when we are doing any clean procedure where no surgical interventions are needed. So the indications of medical gloving, I'm sure you would be curious and thinking, are when we are doing any health assessment, when we are going in contact to any patient, irrespective if the person is having any infection or not, when we are trying to protect ourselves from getting any infection, when we are preparing any chemotherapeutic drugs, a different kind of medical gloves are being used. Whenever we are coming in contact with any blood or body fluids or we are at risk of any contamination, so we are using these medical gloves. Generally, for each and every procedure where you have to save yourself from getting any infection, we are using medical gloves. Now, putting on the medical gloves is very easy. The process of putting the gloves on is called as donning and the process of removing it is called as doffing. Let us see the process of donning. How are we going to do it? It is a medical glove box in which normal medical gloves would be available. Surgical gloves will have a double layer of glare, so you can identify it easily. Let us going forward with the medical gloves. In medical gloves, the gloves would be arranged randomly inside. How are we going to don it? I have already done hand hygiene and my hands are clean. So before we see in detail the steps of doing donning of gloves, let us quickly see how donning of gloves is done. You would be holding it and we are just gliding our hands. So it doesn't look much difficult, right? Again, so this is donning. Now let us see in detail, step by step, if by flaw also, how we are doing donning of gloves. If any mistake also happens, not to worry. Hold from your left hand the rim of the gloves. That is the restricted area where you are going to hold the gloves. We are not supposed to touch the body of the gloves. Easily, smoothly glide your right hand inside the glove. But noticing that your right hand thumb should be parallel to the right hand glove which you are holding in your left hand. So I am going to glide my hand easily, but my right hand should not touch the left hand. So I am going to hold it, but my grip of the left hand fingers would be only at the rim and I am not going further. Now you would be separating your fingers so that it can easily locate itself and your thumb, and you would be gliding the gloves inside. You can see that sometimes our gloves will not fit. If it happens so, no need to worry, because the important part is your fingers are at least separate. Next, we are going to hold the left hand. In that case, what we are going to do, with our left hand, we are again going to hold the rim of the gloves. As we hold the rim of the gloves, that is the restricted area which is corresponding to the space of the wrist. With your two fingers, these two fingers, you are going to hold the outer surface so that this we have a grip. So as I hold the outer surface, I make it opposite, and with my left hand again I will be seeing it should be parallel. So my left hand thumb is parallel to this gloves. I am going to put my hand inside the glove. So once the gloving is done, as the hands are clean and the gloves are also clean, I can easily adjust it. So this can happen sometimes in normal scenario. If not, you are lucky, you have practiced well. If it happens also, no need to worry. Only thing to keep in mind is your bare hand should not touch the glove surface. After this, you can fix it, and this is where your donning of gloves is done. I'm sure you have finished with your procedure, and now it is a time when your gloves are unsterile and you have to remove the gloves. That is, doffing of gloves has to be done. That is also very simple. How are we going to do is, with your right hand, pinch the outer surface of the left hand glove, which is corresponding to the wrist area, and you would be taking your gloves inside out. That is, I am rotating the glove inside out and I am taking it in, and I would be leaving it here. Once it is being done, my hands are clean. I should not touch this unsterile part of the gloves. So I would be taking the two finger and I would be gliding it inside. And thus again I would be turning the glove inside out, and this is doffing is done, which I would be discarding in a bin. So I hope with me you would have understood this procedure of donning and doffing of gloves, and I'm sure it is very easy now for you. So please practice, and this will make you a pro. For more such interesting and lovely videos, please like, share and subscribe MediVaah.